Hello there, and welcome back to the Gluten Free RN podcast. I'm Nadine, the Gluten Free RN. Episode 63, I am going to talk about Poland and celiac disease for a very good reason. Stay tuned. Hello and welcome back to the Gluten Free RN podcast. I'm Nadine, the Gluten Free RN, and for those of you that can't tell by my last name, I am in fact Polish. I'm actually very Eastern European, and of course those borders in Eastern Europe shifted quite a bit over the millennium. But I consider myself to be primarily Polish and very proud of that fact. I grew up in Buffalo, New York, and for those of you that know Buffalo, there's a fairly high concentration of people of Polish descent there. My ancestors came through Ellis Island and landed in Buffalo. So yes, I am Polish, and yes, I have celiac disease. So for those of you that are also Polish, this episode is for you, or if you know anybody that's Polish, or you're married to a Polish person, or you're going to travel to Poland, this would be the episode that you really do want to listen to. And even if you're not, join in because it's going to be another good one. One of the reasons I decided to do an episode on Poland is because during our trip to Europe this summer, July 2018, when we take a cruise on the Danube, a riverboat cruise from Budapest to Prague, Pete and I are taking an extra 3 days. We're flying into Warsaw, Poland, because I really do. It's on my bucket list to go to Poland before anything should happen. So I'm headed to Poland for at least 3 days into Warsaw first before we go to Budapest. I'm very excited about going to Poland, but also a little apprehensive. Because I know from my history with my grandparents, especially my grandmothers who were the bakers in the family, that Poles use a lot of grains and flour, especially wheat, rye, and barley, in their cooking and baking. I distinctly remember very fondly my grandmother making things like pierogis and pastries. While I can't remember all of their exact names, she did speak Polish, and I know to jest nas and a few very, very basic Polish things, such as dzień dobry and pani. My grandmother and her sister called each other pani. So I do know just a very little bit of the Polish language, frighteningly little considering that my grandmother spoke Polish, but I do have very fond memories of my grandmother cooking and baking a lot of pierogis, which were my favorite, and lazy pierogis, which were egg noodles and cottage cheese and maybe some meat in there, whatever she wanted to throw in. Like I said, I have very fond memories of that food. However, I have not eaten any of it in the last 11 years. Once I found out I had celiac disease, I look back on that time period very fondly and realized that a lot of my great memories of my grandparents come from the food that they served. However, I also look back at my family medical history and realize that both sides of the family had signs and symptoms of celiac disease. You can read more about that in my book, Donation, where I chronicle a little bit of the genogram concept, where you look back at your family history, medical history in this case, and realize which family members are probably affected by celiac disease or the ones that had celiac disease but died before they found out. Again, it's a really good idea to get tested for celiac disease. I, as the Gluten Free RN, have been calling for a mass screening of celiac disease ever since I started this 11 years ago, especially after I realized that the National Institute of Health had talked about doing a mass screening in the United States way back in 2004, but they never did it. So you can read more about that in my book too. Donation, a nurse's memoir of celiac disease from misdiagnosis to food and health activism. But like I said, I have a long history of Polish food, lovingly baked and cooked by my grandmothers, and I'm also having this future adventure coming up very soon in July of 2018. of actually going to Poland and to Europe. So good memories and a future adventure, which is another good reason to investigate Poland and celiac disease. For those of you that have been following along with every episode, I just did an episode on the Irish and celiac disease, or Ireland and celiac disease. There was, I have to say, a lot more information about the Irish and celiac disease than there is about Polish people and celiac disease. Keeping in mind that that does not mean that there isn't celiac disease in Poland. There is a fair amount of research coming out of Poland regarding celiac disease, and I have included several of those articles or research papers involving people of Polish descent or Eastern European descent and celiac disease. I have included an article called Screening for Celiac Disease in Poland. And even though I'm Polish, I'm going to defer saying some of these Polish names because I really don't want to slaughter them. But this particular abstract was written in 2009, in March of 2009, and it's entitled Screening for Celiac Disease in Poland. And I do apologize to the authors for not being able to pronounce their names. But I will say Anna, Monica, Lucina, and Waldemar are the first names of the people. And again, I hope I didn't slaughter those first names, but I am attempting. And this particular article, Screening for Celiac Disease in Poland, comes from the Nicholas Copernicus University in Poland. The background of this study is the epidemiologic studies of celiac disease in Poland have been performed only within selected regions of the country and involve mainly symptomatic patients or groups at risk. The aim of this study was to assess the prevalence of celiac disease among children in Poland. Again, this is in 2009, and there really hasn't been a lot of information from Poland. That's why I'm focusing on this particular one. But the methods involved were screening for the presence of anti-endomyocele antibodies, or the EMA, IgA, and EGG EMA, which was performed on 3,235 children born between 1994 and 1997 and living in, I'm going to spell this one, BYDGOSZCZ. Now, a true Polish person would be able to say that without any problem, but I am not going to say it. I just spelled it. Small bowel biopsy was proposed for patients with a positive IgA EMA and or IgG EMA titer. So this particular study did not include anyone with a positive TTG, nor did it test for a total IgA or total IgG. So out of those 3,235 children, they found 25 patients, or 0.8%, that tested positive for the IgA EMA and or IgA EMA titer. Those are only the one small component of the celiac panel. Histopathological features of celiac disease, Marsh stage 3B or 3C, were found in small bowel biopsy specimens from 7 children. Normal histological features were found in 4 children, and 14 children did not undergo small bowel biopsy. Celiac disease occurred more frequently among girls than boys and showed an asymptomatic 2 out of 7 children or oligosymptomatic 5 out of 7 children course. The prevalence of histologically confirmed celiac disease was estimated at 1 in 404 children, but the prevalence of serologically identified celiac disease was 1 in 124 children. The conclusion states that the prevalence of celiac disease in population of Polish children was slightly lower than that in other countries and showed an asymptomatic or oligosymptomatic course, despite finding of advanced histopathologic lesions in the small bowel. I would say that there's several problems with the study. One, that they did not, in fact, utilize a complete celiac panel, thereby finding children that were IgA deficient, nor did they use the tissue transglutaminase. They only used the EMA. They did not use the AGA, the anti-gliadin antibody, nor did they test for the total IgA and total IgG. So they were missing probably a lot more children. And interestingly, they only took 3 samples from different regions of the duodenum for these children. So the standard in the United States is 6 to 15 biopsy samples because the damage can be patchy and we really do want to find it. That's why the standard set by the American Gastroenterology Association is 6 to 15 samples from different areas of the duodenum and hopefully the jejunum also. And those biopsy samples can also be taken from the duodenal bulb. But interestingly, it does note that concerning the group of 8 children with histopathologically confirmed celiac disease, in this study, 2 were asymptomatic, 5 had abdominal complaints of low intensity and or a history of deficiency anemia, 2 had a positive family history of celiac disease, and 1 girl received a previous diagnosis of celiac disease as a result of screening for type 1 diabetes. With the exception of this last patient, the others did not receive a previous diagnosis of celiac disease, despite the fact that some of them experienced clinical symptoms suggestive of this disease. Parameters of physical development were normal in all children in the present study. Only 1 asymptomatic girl had a height at the bottom limit of the normal range. The clinical picture of celiac disease in the present study confirms the predominance of asymptomatic and oligosymptomatic forms of celiac disease over classic celiac disease, which is becoming rare. The ratio of symptomatic to asymptomatic cases in children is estimated to be 1 in 5 to 1 in 7, or even 1 in 12. Our observation of the significantly more frequent prevalence of celiac disease in girls than in boys is consistent with the results of many other epidemiologic studies. Well, there's a few things I would say about this. My Polish researcher people have to be a little bit more vigilant in how they test. They have to, of course, test more people. So there are some problems with this study. They have to include more people in the study. And then if they're going to do the biopsies, they really do need to take the correct amount. The other issue with the biopsy is they're only looking at MARSH3 damage. And I'm not quite sure if they just decided that MARSH1, which is the microvilli being destroyed, or MARSH2 damage, where the villi start to blunt or atrophy, didn't count. So I would suspect that some of those children actually have villus blunting or microvilli destruction, but they were excluded from being biopsy proven because they did not have MARSH3 or MARSH4, which is complete villus atrophy, with these biopsy samples. Lots to think about, lots more work to be done, obviously. However, they are to be commended for doing this study in the first place. So thank you to the Polish researchers for being very progressive in studying celiac disease and actually screening for celiac disease in the Polish children. As a Polish person myself, my antibody test was negative, so I cannot explain that to this point, although I do know in the United States, 70% of the celiac panels are false negative, so I would definitely fall into that category of having a celiac panel that is false negative. Given the fact that I had multi-system organ failure and I almost completely recovered on a gluten-free, dairy-free, soy-free, and then a paleo diet, most assuredly have celiac disease, also given the fact that I am HLA-DQ2.5 homozygous and got genes from each parent. So I got genes from my mother and my father. That pretty much guarantees I have celiac disease or was going to develop it at some point in my life. Further interesting is the fact that my dad was also homozygous. So from my grandmother and my grandfather, my dad also got genes from each parent. So you can begin to see where those genes become very important, apparently, especially when you're Polish. So if you do know anybody that's Polish and they have health issues or they have addiction issues or they have osteoporosis or anemia or they're short or they have abdominal pain or a lot of gas, bloating, diarrhea, and or constipation, those people all should be tested for celiac disease. And in the pediatric population, those children that are anemic for no apparent reason, are falling off the growth chart, are type 1 diabetic, or have any other autoimmune issues, they all need to be tested for celiac disease also. The way celiac is spelled in Polish is Celiakia. Oh, that makes sense. And gluten intolerance is Nitolerancja, and gluten would be glukenu, gluten intolerance and celiac. That's what it is in Polish, per a reference pulled right off the internet. And that's going to be important to me as I travel to Poland this summer, to Warsaw specifically. Do you happen to know any great gluten-free restaurants in Warsaw, especially the ones that would be 100% gluten-free? Do you have any recommendations for traveling to Poland as a person with celiac disease? One of the last things I want to do is get exposed to gluten while I'm traveling, of course. So I will be taking my own food to some degree, at least rescue food, as I like to call it, just in case I don't have anything that I can eat safely or confidently. It is estimated that 1 out of 100 people in Poland have celiac disease, which matches the worldwide estimate. So if that's the case, there's a lot of people in Poland that are not diagnosed with celiac disease. I'll be looking for them when I travel there. As the Gluten Free RN, I find it very easy to find people that have celiac disease either by looking at them or talking to them briefly. It's not hard to find people that have the signs or symptoms of celiac disease. And of course, if you have any family members that have been diagnosed with celiac disease, your risk of celiac disease increases exponentially. Currently, there is no register of celiac disease in Poland, so we really don't know what the prevalence is or the incidence, but I can assure you that there are a lot of people in Poland that have celiac disease or of Polish descent, no matter where you are in the world, that also are potentially undiagnosed celiac patients. And if you're Polish and you have celiac disease, welcome to the club. Thankfully, I am a Polish person that does not necessarily need to eat traditional Polish food to feel Polish. And I'm one of those rare people that has red hair and hazel eyes, but I'm Polish. I didn't even fit into the Irish category. I did my 23andMe and my Ancestry.com. Not a lick of Irish in me. Definitely have red hair, though. I am curious if there are any gluten-free Polish beers available. And also, I would suspect that the 100% made with potato vodka would be safe for an alcoholic type drink. The nice thing I know is that there's a honey mead made in Poland, and it is 100% gluten-free. So that's probably, if I'm going to have anything in Poland to drink that has alcohol in it, it will probably be a honey mead. And if I know my ancestors, I would imagine that there is going to be some alcohol in Poland that is gluten-free. I did post what I found on the podcast notes as far as traveling. Interestingly enough, my good friend Aaron Smith, the gluten-free globetrotter, had already posted a blog about going to Warsaw, Poland, when one of the gluten-free folks from the United States went to Poland for work and also to run a marathon. So there's a lot of us with celiac disease that for some reason that actually like to run marathons. We all like to celebrate not being dead, I think. And the fact that we can just do it. Most of us feel so much better once we go gluten-free that really climbing mountains and running marathons and hiking and being active really is, number one, great for our health. Number two, there are no limits to what we can do once we get rid of all the signs and symptoms that we had been suffering from, or just heal up our intestines. Once you heal up your intestines, you get rid of all of that inflammation and heal up your immune system. So I think I'm much healthier now that I am on my variation of a paleo diet than I ever was absolutely ever in my life. So celebrating that by going to Poland, taking a great group of gluten-free and paleo people on a Danube cruise in July and enjoying every second of my life. I, of course, encourage you to do the same. I want you to be healthy and happy and also travel and travel safely. One of the questions I'm really asked quite a bit is that people think that they can go to Europe and eat the bread or eat the wheat because it's different than it is in the United States. And whether it's different or not, I always caution people. The people with celiac disease in Europe or wherever you're traveling to cannot eat their wheat. So you should not either. And that damage can be done by those proteins in the wheat, barley, rye, and sometimes oats, if you're sensitive to it. That damage occurs whether you know it or not. So I recommend that nobody eat the wheat or the grains in Europe or anywhere else that you're traveling if you have celiac disease, especially or non-celiac gluten sensitivity. This is a worldwide issue. This is not going away. It's not a fad. It's only going to exponentially get bigger as more people get diagnosed correctly. So please do have a high index of suspicion for any of your patients or family members or friends if they have signs and symptoms that, number one, don't make any sense, or they're accumulating diagnoses that is unusual for just about anyone. Especially if those diagnoses are autoimmune diseases such as type 1 diabetes, lupus, Sjogren's, arthritis of any type, autoimmune thyroid disease, or autoimmune liver disease. Celiac disease is grossly unrecognized and underdiagnosed. It is very important that we all keep a really sharp eye out and suggest that people get diagnosed sooner than later. Let's prevent people from having to suffer or being on medications that they don't necessarily need to be on at all in the first place if they get a diagnosis of celiac disease early. It's strictly a diet change, removing the wheat, barley, rye, and oats from your diet, and ideally also removing dairy. At the very least, if not going on some variation of a paleo diet, which is essentially a whole food diet. Meat and fish and eggs, nuts and seeds, fruits and vegetables, with the emphasis on a lot of vegetables, and then replacing all of those nutrients that may be deficient. I can assure you all of us Polish people want to be healthy. We all want to enjoy life, and we all want to travel and have a good time. So if Poland is on your bucket list, stay tuned because I'm sure I'm going to do a podcast on what it's like to travel to Poland, at least to Warsaw. How easy it is, maybe describe some of the grocery store experiences or the restaurants that we come across. So stay tuned for those episodes. Those are going to be exciting too. Well, this has been another great episode of the Gluten Free RN podcast, episode 63 on Poland and celiac disease. If you're Polish, I highly recommend that you get tested for celiac disease and non-celiac gluten sensitivity, and do realize that you can develop celiac disease at any age, with any symptom or no symptom, whether you're a man or a woman, and at any time in your life. It is not only a childhood disease, if it's a disease at all. So anybody at any age should be tested for celiac disease, especially if you have celiac disease in your family or someone has been newly diagnosed. Well, that's a wrap for episode 63, Poland and Celiac Disease. I'm Nadine Gruszkowiak, the Polish Gluten Free RN, bringing you more information every week on the Gluten Free RN podcast. Thank you for joining me, and stay tuned for the next episode of the Gluten Free RN podcast. Stay healthy, get tested if you haven't been, and eat good food. Bye.